Good morning from the Hawaiian Eye Conference in the Big Island of Hawaii. We're pleased to be here this morning with Dr. Cynthia Matosian from Doylestown, Pennsylvania. Thanks a lot for being with us this morning, Cynthia.
Thank you very much. It's great being here.
Cynthia, I always love catching up with you at these conferences because you have such great insight into what's currently on trend in ophthalmology. And that brings us to our topic this morning, which is pharmaceuticals in cataract surgery. We know that there's been a lot of evolution and a lot of change over the past couple of years in what's available as far as pharmaceutical delivery, both intraoperatively and postoperatively. Can you give us an idea of what we're talking about at this meeting in Hawaii about what's new for cataract surgery drug delivery?
Actually, there's a lot new in that arena, and thank you for asking that question. Up until now, we have been using eye drops to try to get medication into the eye to the targeted tissue. But fortunately now we have several FDA-approved products. The first one that was recently approved is Dexacute, which is a dexamethasone intracameral suspension, 9%. And what we do is put a very tiny amount, 5 microliters, into the eye at the end of cataract surgery right before we seal the incision. And this turns into a 2-millimeter sphere that we tuck under the iris between the posterior surface of the iris and the anterior capsule. It's easy to do. The learning curve is very short, and I was fortunate that I was one of the principal investigators to use this product. So it eliminates the steroid drop burden for our patients. What this product does is it delivers steroid for 30 days, more at the beginning, and tapers down just like we would do with drops, and reducing the very confusing drop regimen for our patients or their caregivers of X number of times a day for a week, then less and less, and it being tapered. The second FDA-approved product, which is also super exciting to have, is Dextenza, which is a steroid dexamethasone 0.4 milligram intracanalicular implant that we place into the inferior punctum at the conclusion of cataract surgery. Again, it delivers a steroid over 30 days to minimize inflammation and decrease pain postoperatively.
Well, this is really exciting because, as you mentioned earlier, the burden on patients and their caregivers regarding perioperative eye drops can be quite acute. And as well, we know that realistically, patients aren't getting all the eye drops in their eyes, even if they think they are or they say they are. So this is a way, it sounds like, for the surgeon to ensure that the medication that they want, namely the steroid in this scenario, is getting to the eye and to the ocular tissues for its intended purposes. I wondered, Cynthia, can you speak about how these two FDA-approved steroids affect the way that you use eye drops perioperatively? Does this completely eliminate the need for perioperative steroid eye drops in these patients?
Well, you hit on a lot of really important points. One is the compliance issue. We are eliminating that by we as surgeons placing the product into the eye or into the punctum at the time of surgery. So we know the patient is getting the drug. Do we eliminate steroid use 100%? No. We will reduce it significantly. In complex cases where we're in and out of the eye, where we're using perhaps a pupil dilating device, where there's a lot more inflammation, a history of uveitis in the past, these patients may need additional topical steroid drops, but the average easy sailing cataract surgery doesn't.
Well, that's a great point, and it also transitions us into a concept that many surgeons have been speaking about at this conference and others, called dropless cataract surgery. And this uses the notion that surgeons can also use off-label, we have to put on our off-label hat to discuss this, we'll use off-label intracameral antibiotics at the time of cataract surgery. And so it seems as if now we have an FDA-approved product for delivering steroid to the eye, and there's also an off-label use for intracameral antibiotics. Does this mean that people really can finally achieve that no eye drop cataract surgery?
We're getting very close to that. Yes, we can use off-label intracameral antibiotics, use the FDA-approved steroid either intracamerally or through Dexacue or through a punctal plug delivery through Dextenza. And now we also have Omidria, which is an NSAID that's FDA approved to use during surgery through continuous irrigation through our BSS bottle. So that is quelling the inflammation from the get-go when we first make that incision. So therefore, we're getting very close to perhaps only needing an NSAID a day post-operatively.
Well, that's quite fascinating. And I just want to walk back for a moment regarding the use of intracameral antibiotics, because one of the FDA-approved products that you described is an injection at the conclusion of cataract surgery. We also know that surgeons who are using intracameral antibiotics are doing that as a last step injection during cataract surgery. So can those two be injected simultaneously, or is there a specific order that surgeons should use when considering that?
Well, that's going to, I think, play out as Dexacue becomes available. If I were to do it today, I would put in the Dexacue first, and then put in the intracameral antibiotic, then seal the incision. That's the order I would do it in, but there are surgeons who may prefer to do it a different way. The key is to get the two products into the AC. There is room for the AC to handle both.
Last question, Cynthia, regarding the intracameral antibiotics. I know that we spoke about the fact that these are still not FDA-approved uses of those products, that these are off-label. Do you foresee perhaps an FDA-approved intracameral antibiotic product coming into the fold in the near future?
I hope so, because so many surgeons are using it. We have a lot of data now, not just the European study, but US-based studies demonstrating the economic benefits and the patient benefits of reducing the drop burden, particularly for patients who are confused, they have memory issues or manual dexterity issues where they can't squeeze a bottle, or perhaps tilt their head back due to cervical spine problems. So this way we are removing compliance, making sure we're delivering a premium procedure along with a premium IOL.
Well, Cynthia, this has always been a terrific discussion about pharmaceuticals and cataract surgery. So many exciting things that are coming into the mix, and exciting things on the horizon as well. Thank you so much for sharing your expertise.
Thank you very much.